Hi friends, welcome to this video on antibiotics part 1. Portal of entry. The microorganisms enters through portal of entry. Common routes are skin, upper respiratory tract, GI tract, urogenital tracts, any tubes or punctures. So after they enter through the skin or any other route, they multiply in inflammatory cells. For example, Mycobacterium tuberculosis will multiply in macrophages. After that, they spread through lymphatics and into the blood and to the systemic organs. Infection will spread. And viruses like varicella zoster, rabies, they spread through nerves. Microbes in healthy human body. Some of the microorganisms are normally present in our body. Outer ear aspergillus fungus, skin candida, and small intestine clostridium, intestine escherichia coli, vagina gardnerella vaginalis, stomach lactobacillus, urethra mycobacterium, nose staphylococcus aureus, eye staphylococcus epidermidis. So common gram-positive organisms, bacteria will cause skin and upper respiratory tract infections. For example, Staphylococcus aureus and Streptococcus pneumonia, these will cause skin and upper respiratory tract infections. Gram-negative organisms mainly cause abdomen and UTI infections. So gram-negative Escherichia coli and Helicobacter pylori, Neisseria gonorrhea and meningitis, and Vibrio cholera and Treponema pallidum. And in immunocompromised patients, Pseudomonas and Enterococcus are deadly serious. So bacteria can be classified into cocci and bacilli based on their anatomical structure, and aerobic and anaerobic based on the environment they live in. So when we see the cell wall of the gram-positive bacteria, it has cell membrane and peptidoglycans, whereas gram-negative bacteria has cell membrane, peptidoglycans, and outer one more lipopolysaccharide membrane. So cell wall synthesis inhibitors will effective against gram-positive bacteria, whereas less effective against gram-negative bacteria because of its lipopolysaccharide membrane. So the antibiotics which will inhibit the cell wall are beta-lactams and glycopeptides, and DNA gyrase inhibitors are quinolones, fluoroquinolones, and 50S ribosome and 30S ribosome are there. 30S inhibitors of protein synthesis are tetracyclines. 50S inhibitors are streptogrammin, macrolides, lincosamide, and amphenicol, and oxazolidones. Protein synthesis inhibitors are tRNA inhibitors are aminoglycosides. Cytoplasmic membrane structure inhibitors are polymyxin. So penicillins and cephalosporins, they inhibit the cell wall synthesis. Cephalosporins, as generation increases, gram-negative activity increases. Like initial penicillins are mostly effective against gram-positive, whereas aminopenicillins and small molecular penicillins are effective against gram-negative bacteria. UTI fluoroquinolones, and pharyngitis azithromycin we give, and skin and soft tissue penicillin and cephalosporin first and second generation, and intra-abdominal sepsis third generation cephalosporins. If you want anaerobic coverage, metronidazole. So classification of penicillin based on the source, natural, semi-synthetic, based on route of administration, oral and parenteral, and based on spectrum, narrow spectrum are methicillin, oxacillin, dixoxacillin, broad spectrum are ampicillin, amoxicillin, intermediate are penicillin G and penicillin V, extended spectrum are carbapenicillin, ticarcillin, piperacillin, and mesalocillin, and resistant to enzyme, resistance to beta-lactamase, methicillin, oxacillin, dicloxacillin, non-resistant to beta-lactamase are amoxicillin, ampicillin, penicillin G and V. Resistant to acid and acid unstable, acid stable and acid unstable. Next is cephalosporins are bactericidal beta-lactams derived from fungus. They disrupt the peptidoglycan formation in the cell wall. They have no activity against Listeria, atypical Mycobacterium, and MRSA, and Enterococci. First generation are cefotroxyl, cefalexin, cefazolin. Second generation are cefaclor, cefuroxime, cefotitan. Third generation are cefixime, ceftriaxone, cefotoxime. Fourth generation are cefepime, and fifth generation ceftorolin. General rule: first generation are predominantly active against gram positive, with succeeding generation progressively more active against gram negative strains, often with reduced gram positive activity, except fourth generation, which are extended spectrum agents. Adverse effects of the cephalosporins are nausea, rash, diarrhea, and inflammation at the injection site. Those allergic to penicillin may show cross sensitivity with some cephalosporins, but the figure is thought less than 10% commonly cited. Aminoglycosides include tobramycin, amikacin, neomycin, gentamicin, streptomycin. Aminoglycosides against aerobic gram-negative, mainly bactericidal, inhibits the 30S protein ribosome and nephrotoxic and ototoxic and allergic reaction are the side effects due to aminoglycosides. Penicillins mainly cause hypersensitivity reaction and rash, diarrhea, and abdominal pain and nausea, vomiting. Cephalosporins and also cause same rash, diarrhea, nausea, vomiting, and hypersensitivity reaction and serum sickness and vaginal candidiasis. Some aminoglycosides like gentamicin, tobramycin, they cause renal toxicity, ototoxicity, dizziness, nausea, vomiting, and nystagmus. Classification by generation. First generation of fluoroquinolone include nalidixic acid. Second generation include norfloxacin, ciprofloxacin, ofloxacin. Third generation include levofloxacin, moxifloxacin, gemifloxacin. Fourth generation trovafloxacin. First generation gram negative but not pseudomonas. Second generation gram negative including pseudomonas and some gram positive and some atypical. Third generation same as second generation with extended gram positive and atypical coverage. And fourth generation include same as third generation with a broad anaerobic coverage. Spectrum of antibacterial activity in case of macrolides. Erythromycin, gram positive bacteria, Staph aureus and Streptococcus pneumonia, Streptococcus pyogenes, Corynebacterium diphtheria. Gram negative bacteria include Treponema pallidum, intracellular Legionella pneumophila, Mycobacterium pneumoniae, and Chlamydia trachomatis. And clarithromycin gram positive and gram negative include H. influenza, pylori, and intracellular pathogens, Mycobacterium pneumonia, and Legionella pneumophila. And azithromycin gram positive like Staph aureus, Streptococcus, and Streptococcus pyogenes, and gram negative Mycobacterium catarrhalis and H. influenza. Intracellular organisms like Legionella pneumophila and Mycobacterium pneumonia. So indications include pharyngitis, otitis, sinusitis, and complicated genital infections. Clarithromycin adjuvant treatment of duodenal ulcer due to H. pylori, whereas erythromycin indications are Mycobacterium pneumonia, diphtheria, tetanus, and chlamydia, and gonorrhea and syphilis. Tetracyclines are protein synthesis inhibitors, and these are bacteriostatic drugs. Inhibit protein synthesis reversibly binding to 30S subunit of the ribosome. Doxycycline, minocycline. Tetracyclines statin developing teeth and discoloring permanent teeth, and tetracyclines are inactivated by the ions of calcium, aluminum, iron, and zinc. Avoid associated foods and remedies, and tetracycline may render patients photosensitive. Have an average half-life between 8 to 22 hours. They have poor penetration into the CSF, concentrated in the liver, and may cause microvesicular fatty liver. Broad spectrum antibiotics and particularly useful in chlamydia, mycoplasma, rickettsia, limes, and leptospirosis, syphilis, and legionella and brucella species, and also in treatment of acne. Therapeutic uses of aminoglycosides include streptomycin 1 gram IMBD or 0.75 IMBD for 7 days. Use in TB, UTI, and peritonitis and septicemia. Gentamicin. So streptomycin are effective against Mycobacterium tuberculosis, brucellosis, and Yersinia pestis, and Campylobacterium granulomatis. Gentamicin 3 to 5 milligram per kg per day or divided in 3 doses 8 hourly. Respiratory infection in critically ill and pseudomonas and protease and meningitis. Gentamicin. Tobramycin 3 to 5 milligram per kg per day in gram-negative infections and pseudomonas. Amikacin 3 to 5 milligram per kg per day in 1 to 3 doses. Pseudomonas proteus and staph infections, and neomycin 0.25 to 1 gram QID oral or 0.3 to 0.5% topical, infected wounds, burns, ulcers, and conjunctivitis, and external ear infections. Active against gram negative bacilli and some gram positive cocci, neomycin.